Welcome to my channel Easy Anatomy and Physiology. So today we will discuss about stomach. Stomach is also called the gaster, Greek word that means belly, or ventral, from which we have the adjective that is gastric. So definition: stomach is a muscular bag forming the widest and most distensible part of a digestive tube. Shape: J-shaped in normal build. In hypersthenic, that means heavy build body, it is situated transversely. In asthenic, that is like cylinder-like body build, it sags down. Normal capacity is 1500 cc. In adult, usually empties food after 3 hours. Capacity is 50 cc in newborn. That's why infant require more frequent meals. That's it is the main reason. Function: acts as a reservoir of food, helps in digestion, absorption of salt, water, alcohol, and certain drugs, secretion of intrinsic factor of calcium. You can see the situation: epigastrium, umbilical, and left hypochondrium. Now presenting parts. In this picture, it can see the orifices. The orifice, it is a cadaver dissection of picture. Abdominal organs in situ. The greater omentum has been partly removed or reflected. So this is the stomach. Stomach. This is the stomach. Now let's consider this anatomy of stomach. So it has two orifices: cardiac orifice and the pyloric orifice. Orifice means entrance, right? So we today talk about the external features. So what should we discuss about this? The stomach has two orifices or openings, two curvature or borders, two surface, and two parts, or even actually it has three parts. That the cavity of stomach has three parts. In Bidicora say it has two parts, but I will say that it has cavity of stomach has three parts, that is fundus, body, and pyloric part. Fundus, body, and the pyloric part. In this region you can see this. Okay, this is the greater curvature, this is the lesser curvature. The pyloric region divided into three portions: pyloric antrum, pyloric two part, pyloric antrum and pyloric canal. There's an angular notch, and this is the pylorus, and then it enters into the duodenum through pyloric orifice. This is the cardiac orifice, abdominal part of esophagus, cardiac part of stomach. This is the lesser curvature. That means it has two curvatures: the lesser curvature and the greater curvature. Lesser curvature is concave. You can see in this picture as well. Greater curvature is convex and forms the left border. Right? It is the ventral aspect. This is the rugi. These are the rugi. Orifice, pyloric orifice, cardiac orifice. Right? Cardiac notch. This is the 2 is the cardiac notch. 1 is the esophagus. Right? This 11 is the body. 8 is the pyloric region. This is the pyloric antrum. This is the pyloric canal. Right. Now let's talk about the borders. The lesser curvature starts from right margin of esophagus, goes towards the right up to the pylorus. Right? This region from there to from the right margin of esophagus goes towards the right up to the pylorus. Yes. At the most dependent part, there is an angular notch known as insula angularis. This angular notch is called insula angularis, and lesser omentum is attached here. Okay. In this picture, you can see the pyloric orifice. This is the pyloric orifice, and this angular incisor, right? Anastomosis of right and left gastric artery lies in this border. That means, consider this picture. You can see the laser omentum, and the anastomosis of left and right gastric artery. Left gastric artery, right gastric artery. Right gastric artery and vein, and the left gastric artery lies here. Is it clear to everyone? I hope it is clear. Now the greater curvature. Start from cardiac notch. Start from the cardiac notch. Start from the cardiac notch, right? Now, ascends upwards. Yes, it's ascends upwards, then backwards, and to the left, up to the left, into the fifth intercostal space. Run downwards for us up to the pylorus. Up to the pylorus. Now two surfaces. Anterosuperior, posterior-superior. Anterosuperior, posterior-superior. This is the muscular cord. Okay. Anterosuperior, posterior-superior. Related to anterosuperior related to diaphragm, liver, and anterior abdominal wall. Consider this picture. Yes. It will help you. The anterosuperior related to the diaphragm, liver, and abdomen. This is the liver. And the posterior inferior lies on the following structure constitute the stomach bed. So let's talk about the stomach bed. Stomach bed, that means lies following structures constitute the stomach bed. Left kidney, diaphragm, left suprarenal gland, pancreas, transverse mesocolon, left cloac flexure, splenic artery, and spleen. So the mnemonics to remember the structure constitute the stomach bed is Dr. S3 kills patient mercilessly. That Dr. D suggests diaphragm, S3 splenic artery, suprarenal gland, and splenic flexure, kidney, pancreas, and the transverse mesocolon M. Don't, in some book there is cloac flexure. Don't confuse. Left cloac flexure is equal to splenic flexure of colon. Okay, so don't get confused. So this is the picture: left cloac flexure, spleen, diaphragm, left kidney, transverse colon, transverse mesocolon, body of the pancreas. Sometimes there is a pancreas. Sometimes. Now come to the cavity. So the body cavity of stomach has three parts. In the interior of stomach, temporal and mucous folds called rugae. This is the rugae, right? These are the rugae, the folds. It disappears during distension. Fundus, it is the part above the horizontal line from cardiac notch to greater curvature. Normally it contains gas. In XFM it looks black. From its parts horizontal line from cardiac notch to the greater curvature. Right? This is the fundus or from the greater curvature. Now, pyloric part, it extends from right side of the body to pyloric constriction. That means the pyloric constriction that consider the proximal part of the pyloric part. Pyloric parts further subdivided into This part is further subdivided into two regions, pyloric canal and pyloric antrum. Remember, pyloric antrum is 2.5 centimeter, whereas pyloric canal that is 7.5 centimeter. Pyloric antrum that is 2.5 centimeter and pyloric canal that is distal part that is 7.5 centimeter. Now let's consider the arterial supply. Arterial supply. So remember this, the lesser curvature supplied by the left gastric artery, a branch of cloac trunk. Left gastric artery, okay, and the right gastric artery, a branch of hepatic artery. So you can see the left gastric artery and the right gastric artery, whereas in case of the greater curvature, it's supplied by the right gastroepiploic artery. Right gastroepiploic artery, right? Okay. The greater curvature supplied by the right gastroepiploic artery. Branch of hepatic. It's a branch of hepatic. And the fundus is supplied by 5 to 7 short gastric arteries. Right? You can say the left gastro-omental arterial vein and right gastro-omental vessels. You can see this. Right? The greater curvature supplied by left gastro-omental artery and right gastro-omental artery. Hope it is clear to everyone. These are the Lughi. This is the cardiac orifice. Arterial supply is completed. Now the muscular coating, right? The medial circular layer of the stomach, the oblique muscle layer, the innermost abdominal wall, middle circular and innermost fibers, right? Let's consider this. Circular, longitudinal, oblique, right? Is it clear to everyone? This is the oblique 15. This is the longitudinal layer and this is the circular layer. Okay? The same picture. You can see gastroepiploic artery, same thing. Gastroepiploic artery supplies the right gastro-omental artery or the left gastro-omental artery, that is gastroepiploic artery supplies the greater curvature, lesser curvature, left gastric artery and the right gastric artery. Okay? Okay. Now the lymphatic drainage. Lymphatic nodes and channels are situated along the distribution of major arteries. The vessel drains into local nodes first. They are gastric group, lies along the lesser curvature. Gastric lymph nodes, that is along the lesser curvature, and pancreatosplenic lymphatic nodes, that is to the right. That means, that is to the left, that is to the greater curvature. Now, the nerve supply, autonomic nervous system, sympathetic from cerebral plexus T6 to T10 segments, and parasympathetic from vagi via anterior and posterior gastric nerves. Sympathetic are vasomotor, motor, and pyloric sphincter are chief pathway of pain sensation. This is the clinical anatomy. This is the gastric ulcer. What is gastric ulcer? Breach, that is break in continuity in mucous membrane, occur along the lesser curvature. Very common disease in case of low income groups. A posteriorly perforating ulcer in pyloric antrum produce local peritonitis and abscess formating in omental bursa. This is the ulcer. And there is also gastric pain. It is felt in the epigastrium due to the same segmental supply, that is due to the sensation of visceral pain caused by the distension and spasmodic contraction of smooth muscle. So that's it. Thank you very much.